So that's our conclusion then. Our measured body mass index showed positive trends over the 3 years, and we haven't been yet able to compare that to secular trends. So community-based interventions may help to slow the progression of obesity. As I mentioned, we still need further data analysis to enable comparisons and to explain the mechanisms by how that's working. So in terms of healthy Alberta communities as an investment in community for chronic disease prevention, we know that we have some promising and pending evidence, but parallel evidence such as the example I used before, tobacco reduction, tells us that creating supportive environments does change behavior and attitudes that lead to health outcomes. The community evaluation was really important for us. It was really important for us to build partnerships to value that knowledge and expertise within the community and to enhance the local capacity to act on the determinants of health. We know that changing environments are supportive of healthy eating and that this project in particular has shown sustainability. Our economic evaluation found actually was a very small investment, less than $2 per person per year, and that has grown substantially with additional investment by the communities themselves. Now, one of the things that we found when we were working in the communities, and this is probably not surprising considering that communities are not completely free and independent to act in any way they want as well, that policy became one of the important things to address for these communities. That if a community wanted to change the social environment, part of changing that social environment, particularly the larger social environment, really required moving beyond the community level and going to a more population policy approach. So, for example, if a community wanted to change its transportation policies to make them more friendly for active transportation, very often that would require some political action beyond the community level, perhaps at the provincial level, to ensure that there were resources to do that. So we do know that there have been policy recommendations already made for environmental change, and for those of you who are interested, there was a paper printed, published on this in the Canadian Medical Association Journal back in 2007, and it's the 2006 Canadian Clinical Practice Guidelines on the management and prevention of obesity in adults and children, and there's a specific reference related to policy recommendations for environmental change. And these are a few of the recommendations in that publication. First is that obesity prevention should take a multi-sectoral approach similar to that used for tobacco control. Prevention efforts should invest in and target all age groups. Innovative ways to provide access and programs to less economically viable citizens should be developed. And then, of course, research is important. Research is needed to develop, test, and refine effective policies and interventions, such as best practices, in obesity prevention to enhance the evidence base for future public health interventions. So we took what we know about policy recommendations and we took what we learned from working in communities, and we decided to try to do something about policy. And what we ended up with was a coalition called the Alberta Policy Coalition for Cancer Prevention. Now, it's called for cancer prevention because it was funded by a cancer agency, but I will say that this is definitely a policy coalition that's looking at chronic disease prevention much more broadly. And really what we were trying to do with the Alberta Policy Coalition was to take those lessons learned from tobacco control and apply them to the other behaviors that are at risk for chronic disease, and in particular those that are at risk for obesity, such as physical activity or physical inactivity and diet. So what our policy coalition has done is really taken a look at what policies are out there to promote healthy eating and active living, and then looking at where there might be some appetite for changing policies in these areas. And so we actually did a survey of decision makers to find out where they might be interested in taking a policy approach. And the types of things that we're seeing as taking the lead on are things like restricting unhealthy food and beverage advertising targeting children. We know that Quebec has had such a policy in place for several years, over 20 years actually, and it's something that needs to go a little further, I believe. A second policy approach is promoting policies on urban design and zoning that promote active living and healthy eating. So one of the places where we might start is trying to restrict access to unhealthy foods within 500 meters of schools. So, you know, schools open up, and then right next door, a fast food outlet opens up, recognizing that the students may very well be a good source of revenue for them. And we're hoping to be able to advocate for zoning laws that prevent this kind of thing so that the schools are in a healthier environment. We do have Alberta Nutrition Guidelines for Children and Youth, ANGCY, and they have been encouraged for adoption in schools, and many of the schools are working hard to adopt these guidelines. But what we have found is that recreation facilities don't adopt these guidelines. And so, you know, kids go and play hockey and then come out and the only food or beverage choice available to them is a soft drink. So what we're trying to do is we're working very hard on trying to encourage the update of these nutrition guidelines in recreation facilities. And the final lead area that we're looking at is looking at taxation of the energy-dense, nutrient-poor food and beverage choices. So when you think back to that graph that I showed relating the increased cost of milk over time and the lack of increase in cost in soft drinks over time, we think that taxation of soft drinks would be a good way to remedy that sort of strange price disparity. Just to let you know that we're not the only people in the world who are attempting to do this type of work. The Cancer Council in Australia, and this Junk Food Injunction newsletter actually comes from New South Wales, but many of the states in Australia are working on similar issues, and they have an obesity policy coalition in the state of Victoria. And this, they have a little public service announcement where they have this guy called Schamberger who comes knocking to your door, and basically the idea is you wouldn't let him come to your door and try to influence your kid, but you would let him into the television. So it's their policy, their attempt to get policy change around advertising to kids. And as I mentioned, Quebec has had restrictions on advertising to kids for over 20 years now. And there is a coalition, PHAC, which is a weight-related coalition in Quebec that is really taking the industry to task around those types of advertising that is targeting children. And so because they have this law in the books, they're able to actually say, okay, your advertising is, you know, providing free toys to kids. That's against our legislation on restricting advertising to kids. And so the coalition PHAC has been taking places like Burger King to court, and they are being found guilty of contravening the spirit of the legislation. So, I mean, the fines are actually quite small compared to the coffers of the industry, but it is certainly a place to go, and the recognition that the companies are being held accountable. So I'm going to finish there and just use a quote from a member of Parliament in Australia who, when I was there hearing about what the Australians are doing around policy, his quote was, "Don't ever think our rivals are too big to confront. We might feel like the lonely salmon swimming upstream with the bear awaiting us at the top of the stream. However, I think it's extremely important for us to recognize that you know, we can get by some of those bears, and just to acknowledge some of the funders for the research that supported the research and this talk. Thank you."